20-year-old woman undergoes surgery as part of an occupational assessment. She is found to have an abnormal lesion in the right cardiopulmonary space and subsequent undergoes CT examination which shows an anterior mass predominantly composed of fat with high inclination linear structures within it. So the lesion also contains some round, well-defined gas-containing areas which are bowel loops, whereas like this diagnosis, the primary hernia. Question number 36. Standard short axis view. Which part of the myocardium is uppermost when you look at it? Anterior wall. In standard short axis view, the part of myocardium is uppermost is the anterior wall. Question number 37. Cardiac CT imaging. Which is true ejection fraction evaluation requires retrospective gating. Cardiac CT imaging, which is true ejection fraction evaluation requires retrospective gating. For real structure with multiple cavity lesions in both lungs, needle shows metastatic disease. Needle biopsy shows metastatic disease. Least likely cause is giant cell tumor, distal tumor, because it has calcification. And this chest shows multiple cavity lesions in both lungs. On needle biopsy, it is metastatic disease. These likely causes giant cell tumor, the distal tumor, because giant cell tumor of the distal tumor has calcification. 39. RTA with pelvic and lower limb fractures. BQ scans with multiple peripheral submental defects, most likely diagnosed fat embolism. Whenever there are fractures after RTA, then it may be cause of fat embolism. 40. Which absolute contraindication to thrombolysis? Primary cerebral tumor is the absolute contraindication to thrombolysis because it also has hemorrhage. 41. Which CT features indicates post-primary rather than primary tuberculosis in million nodules? Also, post-primary tuberculosis has absent lymphadenopathy. 42. Following a prolonged angioplasty procedure, patient is noted to have swelling at the CFA puncture site. 4 cm pseudoaneurysm is found. Most appropriate immediate treatment is ultrasound-guided thrombin injection. When we see a pseudoaneurysm at the site of angioplasty, then most likely appropriate treatment is ultrasound-guided thrombin injection. For the mycoplasma pneumonia infection, which is not true, it usually affects the upper lobe. Mycoplasma pneumonia affects the lower part of the upper lobe or the upper part of the lower lobe. So it does not usually affect the upper lobe, it affects the lower lobe. 44. A 32-year-old lady, 27 weeks pregnant, referred for CT pulmonary angiogram, which modification would not be appropriate. Reduce pitch because reduce it to decrease dose. Now look here. For PT pulmonary angiogram, if you reduce the pitch, then it will increase the dose. But if we increase the pitch is normal, so then it will decrease the dose and it will be more appropriate. 45. Flu-like illness, chest with patchy biliary consolidation. CT 1 week after shows areas of consolidation and ground amplification. Traction, direction of the areas most likely diagnosed acute intestinal pneumonia. After flu-like illness, there's patchy consolidation. Then after 1 week, there's ground amplification and traction, direction of areas most likely diagnosed acute intestinal pneumonia. 46. It is not recognized indication for a transjugular intrahepatic portostatic shunt procedure, hepatic encephalopathy. Not indicated of TIPS is hepatic encephalopathy. 47. With regard to ventilation perfusion studies, which is not true, technetium agents have better imaging characteristics than krypton for the ventilation phase. Not true about BQ scan is technetium have better imaging characteristics than krypton for the ventilation phase. Krypton is gaseous, so it has better imaging characteristics. 48. Which suggests ARDS or cardiogenic pulmonary edema, heart size 15 cm. Heart size of 15 cm seen in acute respiratory distress syndrome rather than cardiogenic pulmonary edema. 49. Which makes a thrombosed aneurysm more likely than a chronic dissection? Mural calcification displaced outwards. In thrombosed aneurysm, the calcification will be displaced outwards rather than chronic dissection. 50. Patient undergoes single lung transplantation 10 days post-operatively. Chest elevation with consolidation within the graft lung most likely cause acute rejection. Now 10 days post-op will be acute rejection and consolidation within the graft lung will be most likely acute rejection.